I lost 8 team members for various reasons. It's actually a very emotional story for me to relive the events of that time because there was a lot of pain, sleepless nights, so much stress that eventually it brought on anxiety. I was in a heart monitor for a week. Not only am I struggling to maintain my practice and care for my patients, but I am also a mom and I couldn't spend time with my kids. After bringing the Swiss Monkey Pro on, our new patient numbers increased, if not double, triple what they were before. My name is Ashaunte. I am the Director of Operations for Garland Davis DDS in Garland. Dr. Davis has been at that one location for 30 years. He is our owner doctor. Then we also have 2 associate dentists, 2 hygienists. We have 8 operatories, and altogether, I have a team of 20. During the pandemic, I became a Swiss Monkey client. I don't remember the actual year, but I do remember that I was in desperate need of help. At that present time, we had about 5,000 active patients. We had a full marketing machine going on behind the scenes. We were attracting anywhere between 100 to 200 new patient leads to our practice a month, on top of the established patients we already had in our practice. And at the time, I've had 3 front desk team members and about 3 or 4 dental assistants, 2 hygienists, and 2 doctors. When the pandemic hit, I lost 8 team members for various reasons. We still had a lot of patients to service. On average, we probably handled 80 to 100 calls a day from existing and new patients. I needed team members to help with calling new patients, answering the phones, presenting treatment, following up with patients that wanted to come in and get our services. I didn't have enough people to get it done. It was long nights in that office. I mean, I was in the office until about midnight just to make things go right, calling patients back, converting new patients. I had to become 6 different people. That wasn't working. That wasn't efficient. As a long-term plan, that wasn't going to get us to where we needed to get to. I think the biggest pain point, besides a decrease in collections, of course, was the emotional stress that a lot of us were under. Myself, my doctor, there was just no way that we could serve it without the right team members in place to do it. It's actually a very emotional story for me. There was a lot of pain, a lot of sleepless nights, so much stress that eventually it brought on anxiety. I was in a heart monitor for a week. Not only am I struggling to maintain my practice and care for my patients because that's something that I am deeply passionate about, but I am also a mom and I couldn't spend time with my kids, not being able to provide the type of care that we wanted to our patients because we didn't have the team members in place to do it. Complaints from customers increased. Patients didn't care that we were in the middle of a global pandemic. They needed services. They want what they want because they're paying for that service. Hiring people was just not an option. I remember getting my ND bill at the end of the year and looking at how much money we had spent on ads without those ads being filled. I didn't have a choice but to pivot, think outside the box, and we had really worked hard the year before to increase profits by 300%. So when that happened, it felt like the itsy bitsy spider, everything came crumbling down. I needed relief for the practice, for my owner doctor, for my patients, but also for my team and myself, who was left behind to pick up the pieces. I stumbled across Swiss Monkey. When I first started, we brought on virtual pros to help us answer our phones. We were probably getting about 80 to 100 phone calls a day. I know how valuable that is to get to the phones. If patients are calling you, that means they need some type of service. And a lot of revenue is being lost if you can't get to the phone. I knew that the priority for us is to find someone who could help us capture these patients. That way they can come in to get service. But our practice is very unique, where we have to schedule a certain way to control our day because we have about 10,000 active patients, or at the time, we had somewhere between 5 to 7,000 active patients. We can't let scheduling happen however it's going to happen. We have to have control over it. Could these team members remote in, learn our scheduling style or follow our scheduling template? The pros were always willing to learn our systems, learn our processes, learn our other technology that we might be using. And we were in tune with what those pros were doing, whether it be through the Swiss Monkey productivity report that comes in at the end of the day, which I loved. I love technology. If you can give me any type of data, look, I am slurping it up with a biscuit. And so those productivity reports at the end of the day were golden to really see what are we capturing, how many calls are being made. The technology built in with Swiss Monkey, the ability to remote in, pull phone calls, listen to those calls for quality assurance purposes. Even though this team member wasn't inside of our office, they were 100% connected to the office and brought in and made to feel like a team. We got to know, about them the same way they got to know about us. Our virtual pro, she even sent us over some honey from Tennessee, which was delicious, by the way. It feels like family. Even though the person isn't there, eventually we went cloud-based, but Ring Central was still our main line of communication. What I love about Swiss Monkey is they were okay with pivoting. Whatever feedback I gave them about like, hey, this may work for a smaller practice, but because of how many patients we have, this isn't quite working for us. They were happy to adjust and say, what do you guys need? How can we support you? The team over there at Swiss Monkey is phenomenal. They really listen. And they're okay with trying out new things, even within their own organization, to make sure that they're supporting each practice and their individual needs. Later on, I pivoted to just needing a new patient coordinator who could help us convert the 100 to 200 new patient leads that were coming in. That was crucial as well, because these are marketing dollars that we're spending each and every single month, and we don't want that to go to waste. If you want to see a return on marketing, you have to get to those phones, you have to capture those patients that are looking for service. Finding candidates was a breeze. I love their matching service. They understand that we're busy inside of the office. We don't have the time to interview and look through resumes and setting up interviews just for people not to show. They already have a pool of candidates that they vet and they go through based upon what we're looking for. These are the hours. This is how much we're willing to pay. They go out and find the best candidates for your practice. I really didn't have time to interview. So I said, can you interview these candidates for me, or can they send over a video about their qualifications? Once we narrowed down the candidates, that's when I actually was able to hop on the phone and have one-on-ones with the candidates. And then we found the ideal one. There is no other company that is providing the white glove service that Swiss Monkey is providing. Other companies allow you to log into the portal and you have to still find your candidates. Or they say, we're gonna match you with candidates, but it's more of a lead. You still have to do some type of follow-up. With Swiss Monkey, this is the only company that says, hey, these are the candidates that we think is a great match for you. We're happy to interview them, and then we'll give you 1 to 3 candidates that are worth your time. In healthcare, time is currency that you don't get back, which means we don't have time to waste. After bringing the Swiss Monkey Pro on, who was handling new patient leads, within 3 or 4 months, our new patient numbers increased, if not double, triple what they were before. $100,000 to $200,000 of collection was coming in from our new patients. I think that every single healthcare practice needs to have Swiss Monkey as a partner. Someone who's been in dentistry for 22 years, I know the challenges of the front desk, and I know the challenges of a practice owner, because I have either been in that position before, or I have either worked very closely with CEOs to understand what their pain points are. If your pain point is, I need someone to answer my phones, I need someone to follow up with treatment plans that did not close, that can be done virtually. If you need someone to follow up with your marketing leads, follow up with your insurance verification, your billing and your claims, help you answer your emails, pay your bills, do all of the operational things behind the scenes, maybe credential your doctors, etc., that work can be done virtually. Here's the thing. If every other industry can go virtual for admin work, why can't dentistry do the same exact thing? Swiss Monkey is a time saver, a stress reliever. I would say to any practice owner, office manager, team member who is just hesitant about, is this possible? Could this work for my practice? The answer is yes. Don't let the unknown stop you from growing, but also serving your patients. We have a duty to do whatever we possibly can do to help serve them. They're going to match you with the candidate that fits your office and fits your need. And they're going to hold your hand as they walk you through the process of finding the right candidate. They're going to vet the candidate for you to make sure that they're proper fit. They're going to provide you with the technology to integrate that person into your practice in less than 2 weeks. They're going to send you productivity reports so you can always have a pulse on what your virtual team member is doing. You set the pay rate. You pick the team member. You're still in control. I don't know another company on the market right now that's going to do that. They really, really care about the practice owner and the teams inside of the practice and what they need. My advice to anyone that's on the fence who thinks that this isn't possible, I would reconsider that thought process. I would tell you to give them a call, at least have a conversation with them about what you need. Even if you don't have challenges, maybe your practice is ready to scale. There are unscheduled treatment plans sitting inside of your practice database, patients that need to be followed up with to schedule for their recall. There is hidden money inside of your practice that you could capture right now by having a virtual pro inside of your practice. I would recommend Swiss Monkey to the whole entire world because as healthcare professionals, we owe our patients the best service we can possibly give them. I think that there's so much opportunity that we're not seizing here because we don't have enough team members to handle the workload. This will relieve your stress. It's going to relieve your anxiety. It's going to make your team happier. It's going to make you happier, and it's going to increase your profits.